Right, so the title of the program tonight, The Changing Policy Landscape for Clinical Trials. Changing policies are not always fun to talk about, but I'm going to try to make it a little bit exciting. And in preparing for this presentation and looking back at the changes that we've been through for the last, actually 2 years, we've been through a significant amount of changes. It's amazing all of the changes that have happened due to trying to get more investigators and uh, sponsors to register the clinical trials. So without further ado, what I'm going to cover over the next hour or so. The first thing is, does your study meet the NIH clinical trial definition? This isn't really a change, but this is something that the NIH added to their website in the fall. And I can tell you from my perspective of where I sit with ct.gov, this is probably the most frequent question that I get. I don't think my clinical trial meets the definition, and we go through that over and over. The tree that was put up actually didn't seem to help a lot, but we'll talk about that when we get into it. The next thing is the NIH dissemination plan that rolled out the first of the year, followed by the NIH Forms E. Then we have to look forward to the common rule, which has been delayed and is going to be effective July the 19th in this year. And then followed by, or actually before the common rule, the ICMJE data sharing plan is going to be effective July the 1st. And I'll talk to you more about that. And finally, the FDA tracker, tracking non-compliant trials. This is something that the FDA and clinicaltrials.gov is looking at, and we'll hear more about that in the year if they're actually going to adopt that. So starting, well, actually, the goal for all of these objectives, really, the NIH's goal and all of the federal agencies' goal is to provide greater dissemination, accountability, and transparency to the public. The researchers have been asked to register and report for more than a decade now, and the initial results were not very good. So, more stringent rules were put in place last year and penalties. We'll take a look at all of that as we get into the presentation. In looking back at the changes that took place last year, we started out in January when the regulators reissued clarifications of the requirements. So that started in January. Everyone was kind of scrambling, and then they followed up on it. What was different this time, they followed up with a penalty phase in April. So the penalty phase went into place, and of course, as of right now, we have not had any penalties, which is great, and I hope to keep it that way. But they have been doing a lot of backward cleaning of records, throwing out records that have never did report results or had incomplete results. So I've spent a lot of time myself cleaning up records, going back to the archives and inputting the data. Another thing that happened last year in June was the upload of the protocol and statistical analysis. This is actually a part of the results reporting. And if your clinical trial meets the definition of being a clinical trial, you have to upload the protocol, the full protocol, with all amendments and the statistical analysis. And finally, or actually the other thing that happened in the summer of last year is the consent form needed to contain the following language. If your trial is a clinical trial, the website needs to describe in the consent form that your study is going to be listed on ct.gov, but that this website will not include any information that will identify you, which of course patients are concerned about. And then the final thing is the NIH decision tree that was added in the fall, and that was added strategically for the addition of the forms that were added, the dissemination plan, and also some other things that we'll cover as we get through the presentation. So the first thing that we're going to cover is the NIH decision tree. They, as I mentioned, they put this up on their website in the fall last year to help investigators determine if their trial is a clinical trial. There are a series of 4 questions. If you answer yes to all of the questions, you are involved doing a clinical trial. If you answer no to one question, you are not doing a clinical trial. So the 4 questions are fairly easy, but they get complicated as you go along. The first question is, does the study involve human participants? Fairly straightforward. The second question is, are the participants prospectively assigned to an intervention? Again, not too bad. Where we get into some gray areas is when you ask the question, is the study designed to evaluate the effect of the intervention on the participants? And there's lots of gray areas for what is the intervention. If it's a drug, it's a device, it's a biologic, that's easy. But when we start getting into behavioral activities and things that you're, evaluating to change behaviors, that's when it gets a little bit complicated. And I'm going to show you what their examples of what they can, what they identify as interventions. The last question is the effect being evaluated a health-related biomedical or behavioral outcome. And again, you can get into some gray areas here. I've had some discussions over the past year with some of the investigators where, they're looking at various markers and things like that. It may not be directly tied to a health-related biomedical outcome, but ultimately it is. Okay, so the NIH interventions, the definition is here, and here they give some examples of what those interventions are. So obviously up front, again, drugs, devices, and biologics are pretty easy, but when you get down here into telemedicine, face-to-face interviews, a change in health-related behavior with diet, cognitive therapy, exercise, all of these things get really a little bit more complicated. The NIH health-related biomedical or behavioral outcomes, again, here is the definition. I'm not going to read through it. And then the examples are listed below. So this is, basically a good tool to use. If your study is not a clinical trial, I mean, what constitutes a non-clinical trial with the NIH are studies that involve secondary research with biological specimens or health information. Another area, I would recommend that they have an extensive list of case studies online on their website that really review lots of different studies. I would really highly recommend, if you're in question whether your trial meets the definition or not, to go online and to review those case studies. They really do have a lot of case studies that they provide. And then if you're still in doubt, I always recommend to investigators to consult your program officer. The program officer, usually what I understand is that they will put that in your award letter to register and report results, but sometimes maybe that's not always the case. I would think now, as we're into the, they're more strict about registering and reporting, that it would be in your award letter, but sometimes it may not, and your program officer is a good person to consult with to find out. Okay, so as you move through this algorithm, this is the first column, which involves the NIH and the questions that are asked. The middle column here, basically, let's say your study isn't an NIH study. So they have no control over your study whatsoever. If the next thing that you have to look at is the FDA requirements. Does it meet some of their requirements? And then the third column over here are the requirements for the ICMJE, which is the publication requirements. I'm sorry, yeah, now that's a little bit, that's why I'm going to go through it on the next screen. These are the requirements for the FDA, the FDA, that was actually re-implemented last year. And the questions that they ask Is the study an international clinical trial? But now, the interventions that they actually consider being part of a clinical trial are not like the interventions that the NIH does. I'll show you those interventions in just a minute. They're not as broad as the NIH. Their interventions really focus on drug, device, and biologics. So the next question is the FDA is this an FDA regulated clinical investigation of the drug, biologic, or device? Is it conducted under an IND, IDE? And is it other than a phase 1 or device feasibility? If it's a phase 1 or a feasibility study, you do not have to register. But if it's a phase 2, 3, obviously you have to register. So the FDA and other regulations under the 42 CFR 11, the inclusions, again, are trials of drugs and biologics other than phase 1. And so anything that involves one or more sites, an IND, and again, the drug, biologic, or device. But the exclusions are if the trials do not involve or do not include a drug, biologics, or device, and then such as behavioral interventions, that is actually excluded under the FDA requirements. Phase 1 is also excluded, and the observational studies are excluded as well, where that's different from the NIH. So, the thing is, you've got to check with all the different agencies involved. The first question I ask is, is it an NIH-funded study? If it is, we start to look at those requirements. If it's not, then you go to the FDA, and the final review is the ICMJE. This is actually kind of a critical area, I think, because everyone that is doing clinical research wants to publish. So if you want to publish, this body, the ICMJE, they want you to be registered in clinical trials so that in your article, your abstract, you can include the NCT number, and people who read your article can refer back into clinicaltrials.gov. So they don't, I guess they don't deny you the publication, but they actually prefer the NCT number being to your submission. So when you look at what they require, they prospectively assign individuals to an intervention with or without concurrent, comparison, or control groups to study the relationship, very similar to the NIH with a health-related intervention and a health outcome. Their interventions include, so now here you go away from the FDA, you're looking at drugs, surgical devices, or surgical procedures, devices, and back to behavioral treatments, educational programs, dietary interventions. So, each body is different in terms of what they require. But the real critical point
I got that loan.
is that they
now I have an account with you guys. If I wanted to open up any other accounts, how do I do that now that I have that account?
Registry at or before the first patient start.
Oh, they open it for me.
And, I try to recommend to all investigators to get your studies into.
They sent me some stuff, but they didn't say anything like that. I decided to do check-in.
I'm not sure before the study starts, and I think that we've got a stopgap measure now with the IRB because they request the NCT number up front or before they start the study.
Oh, well, they just did.
Because I can tell you, we've had several people denied publications who actually did not have the NCT number.
I can't do it today. I don't have
a clinical trial, and they were denied.
So is this? But is it? I just wondered if it was like my credit union, if you had to do a deposit, if not. I don't know how that works.
Yeah, I mean, unfunded trials. If it's let's say if it meets any of these requirements here, that it is it includes an
intervention later with my bank
with or without a control group, and you're studying the relationship between this.
Or my credit union, I should say.
Definitely applies. So, and I actually am a member of a task force.
I mean, I don't know. I don't know what's different between you guys and the other credit union I go to.
We've had several conversations about investigators not being denied.
I'll back in another day. I gotta listen to the top
prior to. This requirement will be getting a little more strict. To show you how that is going to happen here in a minute. I know.
Yeah, that'd be great. Yeah. Okay.
Okay, so that is everything I wanted to talk about under the NIH decision tree. Moving on to the NIH plan for dissemination. As I mentioned, I scrolled down December the 29th. We didn't really hear about it until the first of the year. A couple of investigators were calling right after the beginning of the year looking for this policy.
Yeah, I want to do a checking because I think I just have a regular savings account right now.
So this policy
Thank you so much.
January the 18th last year, but CT.gov and the Forms E, which Forms D were in place last year, did not have the infrastructure in place to upload this dissemination policy. So they delayed the issue date of it. But now, because Forms E include the dissemination, a place for you to upload that plan, and you have to include that in Forms E. It has to be included with every grant application. The dissemination plan talks about a lot of CT.gov activities, such as registration updates and summary results, but it is never submitted to CT.gov. And again, the goal here is to improve dissemination, accountability, and transparency. So the plan includes 3 components. The first one is basically that the investigator is committing to registering and reporting results in CT.gov. The second component is that the consent form will include a specific statement relating to the posting of clinical trials information at CT.gov. And the third one is that the institution will have a policy in place to ensure that clinical trials registration and reporting results does take place and people are compliant. So because this started so quickly after the first of the year, we were scrambling a little bit, but we got a policy up in place, and it is found under the OSP website. It is actually found under guidance, and it describes the policy that's in place. So when you need, or an investigator needs, a policy, here is a sample plan for the dissemination, which includes all of the components that needs to be restated or committed to. And you can actually take this information, put it in a document, and upload it on the website under the Forms E. Okay, so Forms E, obviously this became available effective on January the 25th this year. And so for now, everyone that is applying for funding needs to complete and is required to use the Forms E. The Forms D have expired in February, so they're no longer available. And all applications that include 1 or more clinical trials that you have confirmed that your study is a clinical trial must be submitted in response to your FOA and complete the human subjects and clinical trials information. This is a new form under Form E. And I'll run through and highlight this form for you. Again, the goals with the new forms, there are several here, but one of the things that they wanted to do was to separate clinical trials and clinical research studies. Before they could not really track the information quickly for a clinical trial. So this actually helps enhance the precision of the information that NIH collects and tracks. They can quickly pull up the clinical trial studies, look at the number of participants they have, and all of the other metrics that they want to get. Again, this is going to improve the dissemination, transparency, and accountability on almost everything that I look at from the NIH. This is one of their main goals for everything. The one thing that I think is going to be very positive for clinicaltrials.gov, what they have included in the Forms E, they have actually pulled a lot of the clinical trials information that you put into the registration or reporting records, and this is now going to be located on the human subjects and clinical trial information. This is going to position us for some great future data exchange with clinicaltrials.gov, which is going to be great. because if you enter it in one database, then hopefully it'll populate into the other and you won't have to do this twice, which is great. It's not there yet, but it's at least they're planning for it.
Yep.
So the main change with the Forms E that came out this year, the majority of the changes related to the human subjects and clinical trials data. A lot of this information was spread out over many different forms, and what they did, they consolidated it and created a new form, which is called the Human Subjects and Clinical Trials Information Form. So they got rid of this information on a lot of other forms, and it's in one spot. In addition to that, they actually updated several of the other forms, and those forms are starred here that you can see. All of the changes to all of the forms can be found in a handout, and I believe we're going to be posting that on the CCTS website, but they also provided a handout of the high-level summary of form changes so that you can go through and look at every single form that did have a revision, all of the changes that were made, and it'll walk you through that process. There's actually another great resource that is the annotated form sets. So when you really sit down to complete a Form E, I would recommend that you get this annotated form set that can walk you through the application process.
And those are at the NIH site, aren't they?
Yeah, but we are probably, I'm going to speak with Angie and Andy about, putting those on the CCTS website too.
Yes.
To make it a little bit easier. So the only forms that I'm going to highlight, because the other ones are minor revisions, I wanted to look at the forms that got the most major changes. So when you go into your Form E packet, you're going to see the first form that you are supposed to complete is called the Research and Related Other Project Information. When you come to this form they want you to complete first because it drives the behavior on other forms. And one of the questions that it asks in the top section is, does this study involve human subjects? So when you answer that, either yes or no, it populates over here on this human subjects clinical trial information form. So that, it's kind of nice that it moves it there for you. And then actually, let's say your study, the answer was no, I do not have human subjects in my study, then you need to only answer a few other questions and then you're totally done with this form. So the other question is, does your proposed research involve human specimens? If you answer yes, then you would need to include a justification for why human subjects are not involved in your research. You upload that form and then you're finished. You don't have to do anything else to the rest of the form, and the rest of the form is somewhat lengthy. So if you answered yes, up here at the beginning, the next section that you would go to would be the full study record, where you would upload your study record into this field. If you met the qualifications for a delayed onset study, you would upload that study in this area, and there's criteria that you have to meet to do that. Once you are done with that, then you would continue on to the other sections. This form includes 5 sections. The first section is basic information, and you'll probably recognize some of it does come from ct.gov. So matching those data sets would be great. Down here, they've got, actually, if you can provide the clinicaltrials.gov NCT number into this spot and hit this populate button, you could populate the rest of the sections. The only thing, I don't see that working yet, just as they have proposed it, because I don't think you're going to register your study in ct.gov before you complete this application.
Right.
I see this application populating ct.gov, so I think they've got that reversed, and that's going to need to be, worked out a little bit. I mean, they've got to work out the kinks, but at least they're recognizing this information is the same. And we'd like to try to save the investigators some time when they're completing a lot of these forms. The next section is the study population characteristics. Again, a lot of this information is listed in ct.gov. This report also includes an additional inclusion enrollment report. They have a planned report, what is your mix prior to your study and then after the actual mix that you did recruit. The section 3 is the protection and monitoring plans. That, again, a lot of the information is listed on ct.gov. Section 4, protocol synopsis. So here you include your brief summary, the study design, a lot of your interventions. Over here you've got your outcomes and measures. And then here at the bottom is where we talked about earlier, the dissemination plan. So here is where you would upload that dissemination plan and attach it to your application. And finally, the 5th section is any other clinical trial related attachments that you need to upload would be uploaded in this spot here. So that basically, those are really, this form contained the most changes. This is, the only form I wanted to really cover with you. The others are, it's kind of redundant, or not redundant, but would be a little boring to cover. So, you can look for this form and under Form Z. And if you have any questions about some of the information, I'm certainly, because I complete the ct.gov information all the time, I can help you talk through what they're looking for. Okay, moving on to the next change that we're going to see this year is the Common Rule. The Common Rule has been delayed, but the effective revised date is July the 19th, which it should go into place. And a lot of the changes that they have developed and made are already in place, you'll see. This is the first time, which is kind of surprising, that the Common Rule has actually, this is the first time that they've issued any changes. This is since 1991. This effort started back in 2011 with 2 primary goals. The first one being to modernize the protections for human research participants, and the second was to reduce the ambiguity for researchers. The Common Rule also actually has a couple of things that will impact the Forms E. They have some exemption codes that are actually found on Forms E, or Form E, that are not activated and will not be activated until the Common Rule actually is implemented in the summer. So these exemption codes do not work at this point anyway. So the changes that we're going to see from the Common Rule in July, which I said a lot of these things have gone into place anyway. We've got the Single Institutional Review Board for multi-institutional research studies that's already in place here. They also wanted to improve the consent forms and the process of obtaining consent. They felt that the consent form is very confusing. A lot of the information is spread throughout the consent form. They wanted to bring all of that information, or at least a brief summary of that information, to the beginning on page 1, to begin with a concise and focused presentation of the key information so that participants will be able to really make an informed decision about the study. Secondly, this talks more about just a better understanding of the project scope, risk and benefits, so that they are better informed. And the third point under consent forms is that one version will be posted on a public website. Right now, we actually have the optional ability to upload consent forms into ct.gov. It will obviously turn to become mandatory in the summer. So I look forward to seeing that happen. A lot of people go ahead and upload consent forms now just because they want to have those posted. Other Common Rule changes will be that researchers will have the option of relying on broad consent forms for future research for studies on stored identifiable data or biospecimens. Next is establishment of the new exempt categories, which I just mentioned. These new categories will be directed to lower level risk studies, allowing IRBs to focus their attention on higher risk studies. So if your study meets the definition of these two exemption codes, then you would not have to actually register. And then the last one is the removal of the requirement to conduct these continuing review of ongoing research studies in instances where these reviews do little to protect subjects. So those are the basic changes for the common rule. Moving forward, now we have the new ICMJE policy, which is the publication policy. This group controls the upper tier journals, and this is going to be quite an undertaking. Their new policy that goes into place, basically it's going to start in July. They are going to require that everyone that meets the definition of a clinical trial include a data sharing statement. Now, at the current time, those statements, or that space for the statement, has not been fully, I guess it hasn't been fully opened. They are creating that space now, but all investigators that have a clinical trial will have to speak to this statement. And then in 2019, the ICMJ will require a data sharing plan in the clinicaltrials.gov registration as a condition of the publication. So, I guess hot off the press, I got a request this morning from one of the investigators who received a requirement from the NIMH wanting to know how she is supposed to satisfy these requirements that have been requested and are expected as a condition of the funding of her study. So I just got this morning. Obviously, I was talking to a few people. We have not actually put processes in place to manage this, but this is something that we will be doing very quickly because it looks like they're starting early on this requirement. So the thing is, why should we be concerned about this? Why it matters to us? Editors may take into consideration data sharing statements and plans when making these editorial decisions. So certainly you don't want to be denied publication if you don't have these statements, plans, and statements in place. Okay, next is our final topic here, the FDA, the FDA Trials Tracker. Earlier this year, the FDA, or there's an independent company that put in place a software onto clinicaltrials.gov to track non-compliant studies. The FDA has not actually implemented this tracker yet, but they are considering it. And the results are, if they were to consider it, based on what has happened since February when this tracker went into place, the number of studies or clinical trials reported were 64.9%. So basically a lot of studies out there that are reporting. Here we've got 299 that have reported out of 461. If the fines were implemented, the FDA would be collecting a total of $80 million, which isn't so bad. But as of right now, that is not being enforced. We've been told to expect more enforcement this year, and so far we have not seen that, but they are getting very serious about registration and reporting, so it's something that probably is coming down the pipe. And actually, this is an article that was published in the Stat Journal, which is an investigation of trials that fail to report. This was published early this year, and this is an article that actually ended up identifying universities and institutions in terms of what was their percent of trials reported and trials not reported. So if you go on this link, the link that they have in this article, you can pull up UAB and look at the percentage, the results of those that have reported and those that haven't. a lot of us were talking that the results that were pulled up, the results that they use, are studies that happened a long time ago. So, I mean, they're not using the most current studies. They're going back a couple of years. And I can say that UAB is in really great shape right now in terms of the reporting, registration, and reporting. But for studies that happened prior to 2015, those studies, everybody was lenient, and so nobody reported those studies or reported results or even registered. So it's hard to go back and try to clean up some of those records, especially the records before 2010, because the archives here at UAB do not go back further than 5 years. So that becomes an issue. But a lot of those studies got, analyzed into this report. So they have, the percentage of the results of trial sponsors disclosed that 72% of the trial sponsors, pharma companies, of required results had registered and reported. At major university research centers, there was a jump from 58% to 77%, which was actually pretty good. So I think that registration and reporting results is getting better, but I mean, we still have a long way to go. We're probably, here at 77%, just as an average, about a quarter of the way away from registering and reporting all required trials. So the last thing that I wanted to mention is actually the NIH thoughts about the lack of reporting. I mean, I went to a meeting last year and they were just really heavy on, to improve dissemination and transparency. I mean, they are just hammering that away. They have this statement posted on their website. We're dealing with a serious problem. We have to make this better. This is an unacceptable state of affairs. The public money is going to spend to conduct these experiments, and therefore the public, the taxpayers, deserve the right to know what's happening. They additionally said that they disagree with the following statement: commenters who suggest there is no need for coverage of certain types of trials. And they go on to describe those. The benefits of transparency and the need to fulfill this ethical obligation to participants is as relevant to these trials as to trials of any other type. So they totally disagree when people try to say, well, I didn't think my study needed to report results that they don't agree with. But so anyway, that is basically the end of my presentation. Does anyone have any questions? Sure.
I was wondering, if the PI goes to their program officer and they say it's not a clinical trial, do you think ICMJ may come back and disagree? Do you think that can happen? They say if they had approval from
their program officer.
Yes.
I just had a discussion with another investigator recently, and his trial I did not believe met the definition of a clinical trial. And I started telling him about the publication requirements, and I said, listen, I don't want to, tell you you have to register, but if you want to avoid problems in the future and you want to not have to, be challenged by the fact that you didn't register and you don't have an NCT, and they could pick someone over you, I would register your trial. And I think we're going to come down to that, to tell you the truth.
We have a question online.
Okay.
Were these changes applicable to newly funded trials or all, even those active?
The rules went back to this. They were implemented in 2007. So basically, people were expected to register back then. Are you talking about? Let me clarify. Is it registration and reporting, or is it another rule that I talked about during?
We'll wait to see what she says.
Okay.
Well, that was my question.
The rules were in place in 2007. So the rules are not new. They were just re-implemented. Some of the other things that I've talked about through here are new things like the dissemination plan, the e-forms, the ICMJE requirements. They have been around for a number of years as well. So I would say this is not really something that we didn't know about. I mean, but it wasn't really highly publicized. Brian?
She says, clarification, the question was about uploading protocol and other documents to clinical trial.
Okay, so that requirement became effective in the summer of last year, July the 29th. We had to upload protocols and statistical analysis. And I can tell you, just to expand on that for a minute, if you actually are reporting results and you don't upload that protocol and statistical analysis, it will not accept your results. So your record will be flagged and having issues until you upload that protocol and the statistical analysis. So the two have to go together. And yeah, we experienced that with another investigator not too long ago.
She said that.
Okay, good. I'm glad that clarified.
There's a lot of pressure on investigators not to submit for publication negative or inconclusive studies just because they won't get accepted for publication. And so otherwise, how would a person register such results? Because after all, the NIH is saying, look, you gotta get your results out there.
Mm-hmm.
So I'm not quite sure how to recourse.
Are you saying for publication purposes or for in the ct.gov?
Yeah.
Okay.
I mean, publication.
Publication, obviously.
It won't happen.
It will not be published.
Seldom.
Yeah. We were recently having a conversation about that people want the bad results as well as the good results.
Also,
If it doesn't work, we need to know about it.
We do.
We don't need to repeat that study.
right.
So, I mean, they're really pushing hard to report bad results or, results that were not, what you anticipated. So we can, other investigators can save time.
Right. So an aspiring investigator can comb through the clinical trials website in effect to learn, even if not published, those studies that were inconclusive, unpublished, or otherwise.
Mm-hmm. Or that they didn't produce the results you were anticipating.
Right.
They're doing a lot of quality, looking at the studies for the quality of the information that are in there now. And, at this meeting I mentioned last year that I attended, one of the things that happens a lot, like 30% of the time, is that people will change their outcome measures.
Yeah.
Because they didn't get what they wanted.
Oh, yeah.
And so they changed those measures to put something else in there. And that is not what they don't want to see that. They want that to remain consistent. So they're actually looking at various changes right now to make that, where you can't go in there and change that, at least in ct.gov. They can't control what you do, on your own at the institution.
Another one online. Do
Okay.
you recommend registering and uploading as soon as you get the NGA?
The NCT?
Oh, no, it says, do you recommend registering and uploading as soon as you get the NGA?
NGA would probably mean the grant award.
Oh, the grant award. Yes, I would say that would be, something that I would do is to register, right away. Because some of the data exchange can start to take place. And anyway, you're going to need the NCT number when you go through the IRB. They will not approve your study without the NCT number. So, thank you.